and that is biochemistry. We have completed our vitamin B complex. We have studied vitamin A, okay, and we have done all vitamin B. Now we are left with very few topics from our vitamin portion, first aid, and inshallah we will be completing it, I guess, tomorrow. Yes, we will be completing our vitamins tomorrow. Today we will be studying vitamin C and vitamin D, and tomorrow we will be studying vitamin E and vitamin K. And then there are few topics like protein energy, malnutrition, and zinc left. So we will be studying that. Students who are here listening to me, is my background having a distortion? No. Okay, fine. Because there is some noise in my background. I can hear, but I don't know if you can hear that. If not, then it's okay. Otherwise, I have to like close the windows. Wait a second. Okay, let's begin. So let's begin vitamin C, ascorbic acid. Okay, this is a water soluble vitamin. We have 4 water soluble vitamins. Sorry, this is a fat soluble vitamin. What am I saying? Vitamin B and vitamin C. There are 2 water soluble vitamins and 4 fat soluble vitamins. So we have done with vitamin B, which is a water soluble vitamin, and vitamin C again is also another water soluble vitamin. So today we'll be studying this vitamin. Okay. So now in my first lecture, I have told you to remember 3 vitamins as antioxidants: vitamin A, vitamin C, and vitamin E. Okay, so ACE. Remember this, they are strong antioxidants. Okay, so vitamin C is also an antioxidant. Okay, it facilitates iron absorption by reducing it to ferric state. Now, many people are confused with Fe2 positive and Fe3 positive. We have this Fe2 positive, okay, and we call it ferrous. Fe2 positive is called ferrous, and Fe3 positive is called ferric. Okay, Ferric. So ferric. So Fe3 positive is called ferric and Fe2 positive is called ferrous. Okay, so I will not be saying 2 positive or 3 positive. I will be using these terminologies, ferrous and ferric. Okay, so it facilitates iron absorption by reducing it to a ferrous state. That is, it converts ferric into ferrous. Okay, so let me share with you my whiteboard. So let me tell you how it does that thing so that you may remember it for a long period of time, and also it will help you in understanding the iron absorption. Okay, this is my stomach. Okay, this is my stomach. Okay, and this is my duodenum. Okay, this is stomach and this is duodenum. Now here is this blood vessel. This is a blood vessel. Okay, blood vessel. Now what happens is, in here, you are you should know that iron has its forms. Okay, when you take, how do you take iron? Okay, when you are taking it from animal sources, when you are taking iron from the animal sources, you are taking it in the form of ferrous, Fe2 positive. Okay, and when you are taking iron from the plant sources, you are taking it in the form of ferric, that is Fe3 positive. Okay, so there's a difference. Plant sources or fruits and vegetables, you are taking iron in Fe3 positive form, which is an inorganic form. Okay, but when you are taking it from animals in an organic form, you are taking it Fe2 positive. Okay, so what happens is, this iron is absorbed in our body in Fe2 positive form. Okay, like it enters into your gut, into this duodenum lining. If I have to draw this duodenum a bit broader, let me draw it a bit broader so that I can write inside it. Okay, so this is duodenum. So the when the iron reaches, when you eat it, it reaches your duodenum in ferrous form. Okay, it reaches your duodenum in this form, 2 plus form. Okay, and then from here, from the duodenum to the blood vessel, there is this cell which we called the intestinal cell or the duodenal cell, that helps this iron Fe2 positive, this ferrous form, to transport into the blood vessel. Okay, this is the blood vessel lumen, this is the blood vessel. So iron enters from here, okay, into here in Fe2 positive form. It is entering from here to here into Fe2 positive form, but in the blood it has to convert into Fe3 positive form. Okay, so this process which is going on, okay, it does not require, you have to be very patient, and you have to understand this concept. This process which is going on is not requiring vitamin C, but when you intake Fe3 positive inside, so in your lumen, your Fe3 positive has to convert into Fe2 positive by vitamin C. Okay, there are many other things involved in this intestinal cell. There is an apoferritin. Okay, let me make this intestinal cell this big. Okay, there is this apoferritin. Okay, this iron is stored here. There like iron metabolism is like big enough. We have a lot of things to study in it, but we are not studying iron metabolism here. I'm just telling you that how it works. So this is 2 plus. Okay, it is stored in here. Okay, this is ferritin, to which it binds, and then the Fe3 positive directly enters in here, and then it can go in here, because you see Fe3 has this uh, form, but when you have Fe2 in your diet, you have to convert this in your blood vessel, but the Fe3 positive is converted into your gut lining in the Fe2 positive form by vitamin C. So if you will be lacking vitamin C, you will not be able to absorb this Fe2 plus, okay, in your gut. So this concept is very important to understand how vitamin C is working, and there is an enzyme that converts this Fe3 positive into Fe2 positive, and the name of that enzyme is ferric, F-E-R-I-C, ferric reductase. So I will teach you this iron metabolism in hematology, okay? Ferric reductase. This enzyme, this vitamin C, works as a coenzyme to this main enzyme, ferric reductase, which reduces this 3 positive form into 2 positive form. And when we are converting it back again to Fe3 positive, okay, the enzyme here is ferrous oxidase. Okay, ferrous oxidase, because this is ferrous, okay, so ferrous oxidase, but this is ferric, so this is ferric reductase, you're reducing it. So if we go back to our book, you can see, have I stopped sharing? Okay, if I go back to the book, you can see that it facilitates iron absorption by reducing it to Fe2 positive. So Fe3 positive is being converted to Fe2 positive. The enzyme is ferric. This is ferric, okay? Ferric reductase, because it is reducing it into this form. And that enzyme, ferric reductase, is using this vitamin C. Okay, now you understand this mechanism. Then necessary for hydroxylation of proline and lysine in collagen synthesis. This is a very important point, and these two names of vitamins are your MCQs. These two names of vitamin, proline and lysine, are your MCQs, people. Okay, you will be studying this same topic, this same thing in your biochemistry, in your first aid book, cellular portion of your first aid book. So you see this this collagen synthesis, there is collagen synthesis in your textbook, and this is the second step of collagen synthesis, which is hydroxylation of proline and lysine, and it requires vitamin C. Okay, so it is written also over here, hydroxylation of specific proline and lysine residues. Proline and lysine are amino acids, okay? They require vitamin C, and the deficiency of vitamin C then results to scurvy. So vitamin C is responsible for collagen synthesis. And this point is given in here also, and this point is given in here also, and this is your favorite MCQ. So remember this point. It is responsible for this step of collagen synthesis, okay? These two are amino acids. Then necessary for dopamine beta hydroxylase, which converts dopamine to norepinephrine. Now, you know the pathway of forming norepinephrine is very large, it's very prolonged. The amino acid tyrosine, it starts from there. I've saved a picture for you. It starts from this amino acid tyrosine, and then it's converted to dopa, and then dopamine, and then noradrenaline, and then adrenaline. So this is step where dopamine is converting to noradrenaline, and the enzyme is dopamine beta hydroxylase. This enzyme also use vitamin C. Okay, so these are like pathways, so you should know that where you're using. It's not like that, you know, vitamin C is a water soluble vitamin, it helps us getting rid of cold, it's an anti-inflammatory because it's an antioxidant. So normal people only know these things, but you're doctors, you should know at which particular core levels these vitamins are working in your metabolic pathways. Okay, so now I have just told you very two important points regarding vitamin C. The first one I told you is it is important in this collagen synthesis. Okay, it is important at this level. The hydroxylation of proline and lysine. Collagen collagen is a complex form of protein that is present for your in your bones, that is present in your skin, in your glomeruli, in your retinas, everywhere. Okay, so there are 4 and 5 types of collagens, so we will discuss that in biochemistry too in the cellular portion. So you have to, so this is like one thing, very important step. If you will miss this hydroxylation step, you will not go in glycosylation, you will not form pro collagen. When you will not form pro collagen, you will be not, further on, you will not be further on doing this step of exocytosis. It will not come out from this cell into extracellular space. Okay, these all steps will not be there, and you will not be forming collagen. And when you will not be forming collagen, there are diseases. um, there are collagen diseases, which are Ehlers-Danlos and Menkes disease. Okay, so you will be studying those Ehlers-Danlos syndrome. These are very important syndromes, which are because of non-formation of collagen. So osteogenesis imperfecta and Ehlers-Danlos syndrome, Menkes disease. Okay, all of these are because the collagens is not made properly, the synthesis is not done properly, or there is a problem in any of these steps. So vitamin C has a very important role in this second step, which is a very important step. That is why they do ask it in MCQs. So remember this importance of vitamin C, please. And then I showed you this image in which your vitamin C is converting your dopamine into noradrenaline. And if vitamin C will not be there, this enzyme will not work. This enzyme will not work. Dopamine will not be converted to noradrenaline. The levels of dopamine will increase. It will cause other problems. Plus, you will not be having noradrenaline or adrenaline in sufficient amount. And when you will not be having these two things, these are the main neurotransmitters for your sympathetic nervous system. So at how many levels you are destroying your uh, conduction pathways in your body? At how many levels, just because of these vitamin deficiencies? Okay, so these are important things you need to remember. So I've and then I've told you another point. So one was this, the other was this, and the third one was this in the iron absorption. Okay, so in the iron metabolism also, we are converting it into this ferric state. If you will not be converting into ferric state, that would again be a problem, because this iron is not only important for our, for our metabolic pathways, but it is also important for your heme synthesis. So you need Fe2 in your heme, in your RBC, or that structure, that quaternary structure you have. Okay, so there is this, at this particular level, this Fe2 positive is present. So okay, that at that structure of a prototype, you have this Fe2 positive in here. Okay, so people, please, like, you have to remember these points. They are your MCQs. These are the three functions. One is this, the other one is this, and the third one is this. Okay, remember these three functions. And regarding antioxidants, just remember this mnemonic ACE. Okay, I have repeated it so many times so that you can learn it. Okay, so they are found in fruits and vegetables, vitamin C, but they are mostly found in fruits which are citrus, for example lemon, for example oranges, okay, for example grapefruits. So it is found in the citrus fruits more. Okay, ancillary treatment for methemoglobinemia by reducing ferrous to ferric. Okay, from ferric to ferrous. Okay, so we have this when the levels of Fe3 positive are more in your blood, you have this thing which is called methamoglobinemia. Okay, I just told you that in your when your Fe2 positive, when your Fe2 positive reaches your gut in your iron metabolism, it converts to Fe3 positive. So when your levels of Fe3 positive is more inside your blood, you have this condition which is called methamoglobinemia. Okay, and this methamoglobinemia can be previously, ancillary means not now, but like in previously they used to treat it with vitamin C. Okay, so these are some more things you should know and you should remember. Now let's come to the deficiency. So we have this scurvy. You are like listening this terminology since your intermediate level, that vitamin C causes a deficiency which we call scurvy. What happens in scurvy? We have these swollen gums, we have this easy bruising, we have this pitaki, hemarthrosis, anemia, poor wound healing, perifollicular and subperiosteal hemorrhages, and corkscrew hair. So many things to remember. Don't worry, it's very easy. It's very easy. Okay, let me take you to the core levels. Okay, now this picture can explain you many things. Okay, these are the types of collagen. We have type 1, type 2, type 3, type 4, and then we have a type 5 also. Okay, so now you see this type 1 is present in your bones. Okay, so your osteoblasts are made up of this type 1 collagen. It is present in your skin, it is present in your tendons. Okay, it is present in your cornea. Okay, and it is also responsible for the late wound repair. So the important is bone in here. Then your type 2 is present in cartilages. Okay, then your in your vitreous body, in your nucleus pulposus, which is a remnant of notochord. Okay, the type 3 is present in your blood vessels, in your uterus, in the fetal tissues, in the granulation tissues. Okay, the process of repairing. And the type 4 in your basement membrane, I'm talking about the glomerulus. Okay, in your renal, the basement membrane. Okay, in length. So now you see there are different types of collagens and they are present at different levels. So when you will be having a deficiency of vitamin C, you will not be performing this step. You will not be performing this step of hydroxylation of proline and lysine. And when you will not be performing the second step, you will not be forming collagen. Collagen will not form. When the collagen will not form, there will be a deficiency of these types, and that will result in the problem everywhere. In the bone, you will see osteogenesis imperfecta type 1. We will study this in detail. Okay, if you'll see problem in cartilage, you will see that they are like overstretching. Okay, when you will see the problem in your blood vessels, there is a disease which you call Ehlers-Danlos syndrome. Okay, so when you will be having a problem in Ehlers-Danlos, okay, you will be seeing that there will be hypermobile joints. Your joints will have this hypermobility, and your skin will be like super extensive. And you know, like you can right now, if you pinch your skin of your hand, of your dorsal surface of your hand, just pinch your skin and stretch it upwards, there is this tightness in your skin. There is this tightness. But if you are lacking this collagen type 3, and you're a patient of Allergenless syndrome, then you will be like stretching your skin far away. It will be hyper extensible. Okay, similarly, your joints will be hypermobile, and you will have a tendency to bleed as well. You will be like bleeding more and more. So you see, you are having a problem at so many levels because of these collagen misformation. Okay, and then if you're having the deficiency in type 4 and the problem in basement membrane, you will see Alport syndrome, in which you have lots of proteinuria. There is a problem in your kidney, and Goodpasture syndrome in lungs and kidney, both of them. So you're having, you're creating big trouble for you. So let's go back to the page. So now you see you have swollen gums, okay, easy bruising, pitaki, hemarthrosis, so, and anemia. So all of these things are related to the vascular problems. That is, vitamin C is causing problems when you're not able to hydroxylize this, when proline and lysine, and you're not able to do this second step. You are leading to, the deficiency of collagen type 3. Okay, you're having a deficiency of collagen type 3, and you will be seeing swollen gums, easy bruising, pitaki, hemarthrosis, which means that there will be blood in your joints, in your synovial cavity. There will be blood. That is called hemarthrosis. Okay, and pitaki means small, 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 you know uh, blood marks on your skin, okay, but in covering a large area. So that is called pitaki. Okay, and then anemia, you all know, decreased hemoglobin levels. Okay, easy bruising means easy bleeding. Okay, and then poor wound healing, very important. So you're lacking type 1 collagen. Poor wound healing, you're lacking type 1 collagen. This is asked in your MCQs previously. Poor wound healing. Remember this for MCQ, okay? You have to remember all of them actually. They're all important, okay? And then perifollicular and subperiosteal hemorrhages. So periosteum this is your bone, okay? So there is a lining of collagen on your bone. It's transparent. Okay, that is called periosteum. Outermost covering of your bone is called periosteum. So you will see blood below this periosteum, which we call subperiosteal hemorrhage. So that means you're lacking type 1 collagen again. Okay, and corkscrew hair, because your type 1 collagen is also present on your skin, and you see this is your skin, and you have this hair bulb present over here, and then sebaceous glands present over here. So because of the lack of collagen, because of the lack of formation of your epithelial lining of your skin, your hair will be like this will be the shape of your hair, corkscrew hair. Okay, so remember this corkscrew hair. This is a classical point for vitamin C deficiency, and it's asked in MCQ a lot. Then we have weakened immune system. Weakened immune system, okay, because it's an antioxidant. It helps kill pathogens. Okay, so if you'll be lacking vitamin C, you'll be having a weakened immune system, and you will be prone to many diseases. Okay, people, so here you are you got this whole deficiency part. Okay, so see here they have also written that it causes scurvy due to a collagen synthesis defect. So that is why this point which I told you, hydroxylation of proline and lysine in collagen synthesis, is very important for MCQs. It is asked repeatedly, so remember this point. Okay, and it's given 2 times in your biochemistry book, so there is no way you can ignore this. Then we have excess. Okay, so nausea, vomiting, diarrhea, fatigue, calcium oxalate nephrolithiasis. Now this is important. You see nausea, vomiting like everywhere, but diarrhea because because of your basement membrane, like you see when your collagen is not formed and at your basement membrane, you see this Alport syndrome. Okay, your protein is lost in big quantities because your basement membrane does not allow the large protein molecules to get excreted in your urine. Okay, but when you take this vitamin C in excess, because it is water soluble vitamin, it needs water to absorb. So large quantities of vitamin C can lead to diarrhea. Okay, in diarrhea, we have more water content. So that is why this excess use of this vitamin C can cause diarrhea. Now, one more thing you need to remember, we studied we studied vitamin A and we studied vitamin C. In both of them, we studied excess. Okay, but in vitamin B complexes, we have not studied excess. So remember that point. We have studied excess in one vitamin. If I am remembering, it is vitamin B3. So you can check in your book. You have studied podagra, okay, in vitamin B3 excess. So you can check it in your book. So up till now we have studied 3 vitamins, and in which we have studied that there is not only deficiency but there is excess. So one was A, one was B3 niacin, and now we are studying C. Okay, so remember these points as well. Then fatigue. Definitely, if you'll be having diarrhea, you'll be losing your electrolytes and you'll be going in fatigue. Calcium oxalate nephrolithiasis means kidney stones. Okay, calcium oxalate kidney stones will be formed because of more vitamin C. Okay, and increase iron toxicity in predisposed individuals by increasing dietary absorption. So again, they're only talking about the excess. It's the same thing. That is, can worsen hereditary heme chromatosis or transform related iron overload. So there are 2 types of hemochromatosis. One is hereditary, which we call primary. Okay, and the another one is secondary, like which you adapt, okay, because of the environmental changes. So please remember that never give vitamin C to a patient, never prescribe vitamin C to 2 patients, one who is having a hereditary problem of hemochromatosis, okay, and the other one who is having a problem of transfusion related iron overload. You have given lots of blood to the patient, okay. There is an overload of RBCs. RBC contains iron, okay, Fe2 positive. So the patient is an iron overload, and you are giving him vitamin C, which is converting more and more Fe3 into Fe2. So it will worsen the situation. Never prescribe vitamin C to such patients. Also, never you have to like counsel them that you please do not take the food that has vitamin C, for example the citrus fruits, okay. And if you're taking any vitamin capsules or things, please stop it. Or if you find a patient who is having hereditary hemochromatosis, and if that patient is taking that multivitamin supplement, you have to tell that patient that you need to stop taking that multivitamin supplement, especially vitamin C. Okay, because in both of these conditions you are in iron overload. Okay, there is more and more iron in your blood, and that causes this problems. And if you take vitamin C more, it will also increase this Fe2 positive more. So it is like leading that that patient to vulnerability. Okay, so like remember these points. So um these points are not as but they are like for your general knowledge and for your clinical things. But you have to remember calcium oxalate nephrolithiasis can be because of vitamin C. Okay, women patients do this thing wrong. They have an option of vitamin B and they have an option of vitamin C and they mark D. Okay, I'm telling you, they mark D, but D is wrong, it is C. So remember this point, and then you have to remember corkscrew here. You have to remember what are the things you see in scurvy, all of them, okay? And remember poor wound healing, okay? And then please remember this proline and lysine point, okay? Even if you forget the other points, but like I've explained you so that you may remember the mechanisms too, okay? So that it will help you remembering the functions and relating the functions, the deficiencies as well. So here we have finished our vitamin C. I have opened book. Where is the book? I have opened this book. Where is the book? Okay. So I've opened this book. This is your Lippincott, okay? And in here also, like they have not touched the clinical points, but there are important points like it is um, it is a reducing agent, okay, and then like because it converts Fe3 into Fe2, okay, and it serves as a coenzyme in hydroxylation reactions, okay, hydroxylation of prolyl and lysyl residues of proline and lysine residues of collagen, okay, and I've showed you in your first aid. And then they have tell about it. It helps in wound healing, okay, it facilitates the absorption of dietary iron from the intestine. So all of these points are same, okay? So you just need to if you like studying biochemistry from your first aid book, there is no way you will do any MCQ wrong, but you have to study it this way, like not like reading it and forgetting it, okay? And then the deficiency, you see scurvy, which is characterized by sore and spongy gums, loose teeth, fragile blood vessels, swollen joints, anemia. So all of the things are same, okay? And many of the deficiency symptoms can be explained by a deficiency in hydroxylation of collagen, okay? So like they are telling you that there is a problem in the hydroxylation of collagen. That is why we are having these problems. So I just explained you how, okay? Resulting in defective connective tissue. Okay, so we have this prevention. So it vitamin C prevents from chronic diseases. I just told you how there are Allergenless syndrome, there is Menkes disease, there is Alport syndrome, there is good posture syndrome, there is Osteogenesis Imperfecta, and definitely cancers, skin cancers, okay? So now you see vitamin C is one of a group of nutrients that includes vitamin E and beta carotene, so ACE, okay? So that's for antioxidants, are known as antioxidants. Beta carotene is vitamin A, okay? Consumption of diets rich in these compounds is associated with a decreased incidence of some chronic diseases such as coronary heart diseases and certain cancers. So they've not explained like in big way, but I'm like kind of telling you. However, clinical trials involving supplementation with the isolated antioxidants have failed to determine any convincing beneficial effects. So it's not like we give vitamin C to treat these diseases and we will not give any medicines. So it's like in conventional treatments in hospitals, it's like not so favorable, but we do give it as supplements, okay, because it's helping in many processes. So we have done vitamin C here. I hope you people have understood, I think, and I will end this recording, okay, and we will begin the recording again so that I may teach you vitamin D, okay. I don't know how long vitamin D will take. It is a long topic. Vitamin D is a long topic, but daily I am doing these lectures which are 1 hour 30 minutes. So vitamin D is a long topic. There's a lot to explain, but this part is long to explain, okay. So I will be ending this lecture. Please join again so that we may start vitamin D over, okay. I'm ending this lecture. Please join again. Thank you everyone.